Hello everyone, it's Justin Vaughn with MiraMed Global Services. Our article today is entitled 2022 IPPS Proposed Rule, Possible Changes for Hospitals. Let's begin. Last week, the Centers for Medicare and Medicaid Services, or CMS, released its Fiscal Year 2022 Medicare Hospital Inpatient Prospective Payment System and Long-Term Care Hospital Rates Proposed Rule. Talk about a title, along with a fact sheet that acts to summarize the critical parts of these proposals. The following will highlight some of the more critical components of the proposed rule, which we will refer to from time to time as the PR. As the PR is over 1,900 pages long, our summary will be provided in a multi-part series of alerts. So we're looking at this article today, as well as perhaps at least one or two more beginning next Wednesday. This first section is entitled Payment Rates. General acute care hospitals that successfully participate in the Hospital Inpatient Quality Reporting Program, or IQR program, and are meaningful electronic health record, EHR, users will see an increase in operating payment rates of about 2.8%. However, hospitals may be subject to other payment adjustments under the PR, including payment reductions for excess readmissions under the Hospital Readmission Reduction Program, payment reduction of 1% for the worst performing quartile under the Hospital Acquired Condition Reduction Program, upward or downward adjustments under the Hospital Value-Based Purchasing Program. Overall, CMS estimates hospital payments will increase by $2.5 billion in fiscal year 2022. This section is entitled COVID Treatment Add-on Payment. In response to the pandemic, CMS established the new COVID-19 Treatments Add-on Payment, or we'll call it NICTAP, for eligible discharges during the public health emergency, PHE. The agency anticipates inpatient COVID cases beyond the PHE. To minimize potential payment disruptions associated with providing new COVID treatments, including those following the end of the PHE, CMS is proposing to extend the NICTAP payments for eligible COVID products through the end of the fiscal year in which the PHE ends. The proposal would also discontinue NICTAP for charges on or after October 1, 2021 for a product that is approved for new technology add-on payments beginning in FY 2022. This next section is entitled Negotiated Rates Requirement. CMS is proposing to repeal the requirement that a hospital must provide the median payer-specific negotiated charge that the hospital has negotiated with all its MA organization payers by Msdrg for cost reporting periods ending on or after January 1, 2021. CMS estimates this will reduce administrative burden on hospitals by approximately 64,000 hours. If finalized, this will be seen as a major victory for hospitals that have been fighting for this change for some time now. All right, so that made some real news. This next section is entitled Msdrg Relative Weight Policy. The agency is also proposing to repeal the market-based Msdrg relative weight methodology that was to be effective for FY 2024 and instead continue using the existing cost-based Msdrg relative weight methodology to set Medicare payment rates for inpatient stays for FY 2024 and subsequent fiscal years. This next section, Hospital Readmissions Reduction Program, or HRRP. Now, this HHRP is a Medicare value-based purchasing program that reduces payments to hospitals with excess readmissions. It also supports CMS's goal of improving outcomes for Medicare beneficiaries by linking payment to the quality of hospital care. Specifically, the 2022 PR is proposing to suppress the hospital 30-day all-cause risk standardized readmission rate following pneumonia hospitalization measure NQF number 0506, beginning with the FY 2023 program year. It's also going to be modifying the remaining 5 condition-specific readmission measures to exclude COVID-19 diagnosed patients from the measure denominators, beginning with the FY 2023 program year. And it's going to be seeking public comment on closing the gap in health equity through possible future stratification of results by race and ethnicity for condition/procedure-specific readmission measures, and by expansion of standardized data collection to additional social factors such as language preference and disability status. This next section is entitled Hospital Acquired Condition Reduction Program. The Hospital Acquired Condition, or Hacc, Reduction Program creates an incentive for hospitals to reduce the incidence of hospital-acquired conditions by requiring the Secretary of Health and Human Services to reduce payment by 1% for applicable hospitals, which are subsection D hospitals that rank in the worst performing quartile on select measures of hospital-acquired conditions. The 2022 PR would suppress the third and fourth quarters of CY 2020 CDC National Healthcare Safety Network Healthcare Associated Infection and CMS PSI 90 data from performance calculations for the FY 2022 and FY 2023 program years. Next section is entitled Extraordinary Circumstances Exceptions. With respect to the Hospital Readmission Reductions Program and the Hacc Reduction Program just discussed, the 2022 PR clarifies that an approved extraordinary circumstances exception, or ECE, would not accept, and that's EXCEPT, would not accept a facility from the quality program, but instead that the facility would be accepted, again, EX, not ACC, accepted from reporting data for the approved data reporting period. So again, just to repeat, the 2022 PR clarifies that an approved extraordinary circumstances exceptions would not accept a facility from the quality program, but instead that the facility would be accepted from reporting data for the approved data reporting period. We plan to provide a second installment, perhaps a third, of the highlights coming out of the 2022 IPPS proposed rule in the coming weeks. In the meantime, if you have a question for us, including how we can help you with your business needs, please feel free to reach out to us at info@mirrormedgs.com. Thank you.